week on Womanity is Dr. Sheri Prentiss. Dr. Sheri is a medical doctor with over 31 years of experience, a Joe Biden Presidential Lifetime Achievement Award recipient, a mother, a best-selling author, global speaker, minister of the gospel, and a cancer survivor. Dr. Sheri joins us in studio today to share about her journey through breast cancer, treatment, and victory over cancer. All the way from Chicago, USA. Ladies and gentlemen, welcome Dr. Sheri to Womanity. Dr. Sheri, thank you so much for agreeing to come in for a chat.
Oh, it's my pleasure. I'm excited.
I'm so happy to have you on Womanity, and I'm excited for the audience also to get to hear your story and to pick from what your life has been, the journey of your life. So there's plenty for us to delve into, but I think let's begin with the fact that you're a cancer survivor.
Yes.
My gosh.
Yes.
Please take us down what that was like. What kind of cancer did you have? Mm-hmm.
Yes.
Tell us a bit about that.
It's interesting because by the time I was diagnosed, I had given the diagnosis to so many patients, never thinking that it would one day be me. Mm-hmm. And one thing that I do, and I tell every woman and every man, that if there is a screening test to be done for cancer or for blood pressure or for diabetes, get in and get your preventative testing and clinical exams done. Mm-hmm. And so the first of the month, I always use that opportunity to check my breast.
First of the month.
First of the month. That's how I always remember, right?
Yeah.
So, first of the month, October 1st, 2008, I was doing my self-breast exam, and I felt a mass. And because you do it every single month, you get to know what your normal is. So I knew when I felt it, it was not normal. And the moment that I felt it, I knew it was cancer. Now, I'm not a pessimistic person, so I'm not like, oh, but I just knew. Mm-hmm. God reasoned in my spirit that that's what that was. But because I had taken some close friends just recently on that same breast cancer journey, I already had the breast surgeon in my phone. I had plastic surgeons lined up in my phone. I had oncologists because I was helping them. The moment that I felt it, I literally called the breast surgeon at her home. It was 9 p.m. on October 1st. I'll never forget it. And she was like, Sheri, what is it that you want? I said, I found a mass. Just tell me whether or not you want me to get a diagnostic mammogram, an ultrasound. What do you want me to get first? An MRI? What are we doing? And she said, Sheri, calm down. We're going to get your testing done first, and then we'll go from there. And subsequently, we did a biopsy. In her mind, when she examined me, it felt small. Small, but, it was there. And she's, in her mind, we'll do a lumpectomy, remove that mass. Maybe you'll need a few rounds of radiation, and Sheri will be done. Mm-hmm. Somewhere again in my spirit, I just felt like it's going to be more than that, but God, have your way. And what ended up happening is I had a partial mastectomy where they removed half of my right breast. I woke up with drains hanging out of the sides, and I went through 15 rounds of chemotherapy and 33 treatments of radiation. So it wasn't as simple as she thought. It was small to the touch, but it was growing inward. It was advancing to my lungs so fast that had I waited another 6 months, say, I wouldn't be here. I was on my way to death from cancer, after having treated and helped so many others on that same journey. Mm-hmm. And it threw me. I have to admit, when you turn physician to patient, it can knock you off your feet. Because I only took 3 days off of work. Those were the 3 days for surgery. When I came home, drains hanging out at all, I was still working. I was overseeing 22 different facilities by that time in my career, and I had 110 full-time employees reporting to me. That didn't include the part-time employees and the as-needed employees, so there was no time off for me.
So your recovery also included loads of work.
Absolutely.
Take us now into the doctor's office, seeing as you are a physician yourself. When we talk of radiation, what is that?
Yeah. Radiation is a treatment that will fool you. So you're in this huge machine. It's very open. You lay down and you don't hear anything. And in the moment you don't feel anything, they're actually shooting treatment forms of radiation, not the kind of minor radiation you get with X-ray or mammogram or MRI. People should never be afraid of going through screening because of the minor little radiation that you get as a result of screening tests, because the benefits outweigh the risk. But for radiation, I had to go through intense radiation of my breast, up under my arm, and my neck because of the aggressive nature of my particular cancer. Because when they did the biopsy, they also did pathology on that specimen. And pathology means they go a little bit deeper to be able to determine what's the risk of recurrence, how aggressive is this cancer. So that informed the type of treatment that I needed.
So pathology is a test.
Pathology is a group of tests, if you will.
Okay.
So there's a pathologist that will run several tests on this piece of tissue that they retrieved from you.
Yes.
And they'll run several tests looking for certain markers. And if certain markers show up, it lets them know, oh, this has a risk of high recurrence if we're not aggressive.
Okay.
Or this has a low risk. And
So-
based on that risk is your treatment.
Clearly, you had several kinds of treatments,
Yes.
a combination,
Yes.
to get you to the place that you're in. But at the beginning, you said you checked for a mass and you found one and you knew that it was a cancerous type.
Yes.
Does this mean one can have a mass and it not be cancerous?
Absolutely, 100%. So you can, the whole point of doing regular exams is so that you get to know what your normal is. And so yes, you can find a mass, and the reason why they do a biopsy, because sometimes the mass is just filled with fluid. It's a benign cyst, no problem. There are women that have fibrocystic disease of their breast and they may have several lumps. Unfortunately, it takes them through scares every single time, because you never know. You never want to dismiss a mass simply because, oh, my first two were cysts. But when it shows up a certain way on the mammogram and on the ultrasound, you see fluid and you can see mass. So they look different. And mine was homogeneous. It was kind of like a mix. Some fluid, some mass. But that particular mix wasn't a great mix. And yeah, it indicated that it not only was an aggressive tumor, but it had a high risk of recurrence. I was still remained on treatment for an additional 10 years after radiation with oral medication.
Okay.
Yeah.
What does a normal breast feel like?
A normal breast, especially for, and it will depend on your ethnicity. Black women have a tendency to have hyperdense breasts. It's just part of our makeup. And so when we feel our breasts, it may feel kind of lumpy in certain areas, not a real mass, but just lumpy, mountainous. That's why it's important to feel on a regular basis, because sometimes now I know this mountain over here, but wait, this mountain right here feels a little different. I hadn't noticed that before. And so it should feel soft. It should not be painful. There should never be, say, discharge from your nipple unless you have a little baby and you're nursing. There should never be any blood from your nipple. If you see any dimpling around the breast, that should never happen. You're looking for a retraction of the nipple. Like if you see one looks normal and the other one's kind of going inside, that's a sign that that's not good. If it starts to look like an orange peel on the outside, that's not good. If it's red, hot, or swollen, that's not good. Yeah.
So the mass that you felt was hard?
It was hard and small.
Okay. So
Hard and
almost
small.
like there's something in there that should not be there.
Exactly. And it felt small on the surface because it was growing this way. So it turned out not to be small. It turned out to be rather long, but all I was feeling was this little tip. And that's why it's so important that when you feel it, you go in and you get additional testing done. And then after, since the mammogram and the ultrasound showed something that this looks cancerous just because of the way it's showing up on those tests, let's do a biopsy. And then she did a needle aspirate biopsy where you go in and you suck some of the tissue out and then you send it off to the pathologist to run the test. They determine whether or not it looks benign or malignant, And if it's malignant, well, what type of cancer is it? There's
Okay.
various different forms of breast cancer. They're not all the same type, and they're not treated all the same way. There's
So-
some that are more aggressive.
Benign, malignant.
Yes, benign means good. I don't have to worry about it. Malignant means cancer. I really better treat this. Yeah.
I'd like to know what it felt like for your body as well. Because I think sometimes we know what a headache feels like. Because a majority of the population will get a headache at some point.
Yes.
For cancer, it's definitely something that a group of people understand. Did it hurt your body?
Yes.
Did you feel pain, actual physical pain?
I did.
Because of the growth itself, or was it from just the radiation?
The treatment or what?
What did it feel like?
Very good question. Very good question. Actually, with me, what I failed to mention was in around July, I felt a lymph node under my right armpit. It was swollen and it was tender. Usually when lymph nodes swell up and they're tender, that doesn't indicate cancer.
And lymph node would be?
A lymph node is, we have lymph nodes throughout our body, on our neck, our chest, on our arms, in our groin area. That's part of our immune system. And they are there to attack those things that try to come in, whether it's virus, bacterial, cancer, any type of thing like that.
So what is the location of a lymph node?
Oh, you have tons. So they're here, 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 belly, groin, under the arms. They're everywhere. They're helping that immune system. And so when you feel a painful one, usually it's reacting to something. Maybe I had an ingrown hair up under my armpit when I shaved. That's what I thought. It's tender. And then it went down. Never thought anything of it. But when I had my surgery, when they removed half my right breast, they also did what's called a lymph node dissection, where they took 16 lymph nodes out of my armpit. 3 of them were positive for cancer. And for me, as it turns out, that one that was painful was one of the ones that was positive for cancer. But it was minor pain.
Oh, right.
Minor pain. It was not major. That part was minor. The cancer itself, when you are experiencing a painful, hot breast, like I said, that's usually indicative of inflammatory breast cancer, and yes, that could be very painful. I had something called invasive ductal carcinoma, and so it got into the milk ducts of the breast. So that portion did not feel painful. So I can honestly say, outside of feeling that lymph node, which wasn't thinking cancer at all, I'm just thinking I had an ingrown hair, it'll go away. That part was not painful at all. But coming home from surgery, having the drain, them snatching out the drain, the chemotherapy causing neuropathy in my hands and my fingers, losing the sensation, the lymphedema that occurred in my right arm, hand, and fingers, that was painful. The radiation, yes, that was painful. I was tired. Taking the medication that I had to take for the next 10 years after my diagnosis, it exacerbated some of the pain because of the neuropathy. You're reminded. There's not a day that goes by that I'm not reminded that I'm a breast cancer survivor simply by looking in the mirror.
Talking about the surgery and saying they removed half of your breast?
Half of my right breast. So I woke up quite deformed because the left was normal and the right was, half of it was gone. They kept the tissue on the outside. They just had to keep, the reason why they ended up taking half is because they took the lump. Like she said, we'll just do a lumpectomy, take it out. She was wise enough to, before closing me up, she sent the specimen down to the pathologist and said, test it and make sure all of the margins are clean, that there is no cancerous cells in the margin. And she had to do that 4 times because every time they kept going deeper, it was still cancer around the margins. So they kept going deeper. So now I'm expecting to wake up an hour and a half, 2 hours at the most for this lumpectomy and the lymph node dissection. I wake up 5 hours later, it's dark, and I'm being wheeled into a hospital room when I'm supposed to be wheeled in recovery. It's supposed to be a day procedure. I go home the same day, and I wake up to being wheeled into the hospital room, and yeah, I'm in pain. That drain was very uncomfortable.
You said you had on speed dial
Yes.
All the
breast
doctors
surgeon had
and
him on
breast
speed dial.
surgeons and
Yes.
everything. Did
Yes.
you end up having reconstructive
I
surgery
did not.
as well?
I had debated, and because of the chemo and the radiation, I needed to get through those before I could even think about reconstruction, because trying to undergo reconstruction while you're going through chemotherapy and radiation it's a waste of time, because you're still destroying tissue. So afterwards, now my life is really full because I've been working, there's changes on the job and the kids, and I just keep moving, and over time, scar tissue filled in. And so even though it's still clearly less than the left, enough scar tissue filled in that I said, I'm done with enough surgery already. I'll be okay. But then I have to also deal with looking at my body and getting over that image if I decide to be in an intimate relationship.
Oh.
That's a whole nother show. When you think about what you go through and how that impacts your relationship, not only with your children. I'm on my girls right now. My oldest just turned 30. So she's had the conversation with her OBGYN about she's already had markers tested for breast cancer. So they're on their increased risk. So they have to get tested and screened earlier than I did. But it's also in that intimate situation. Women's husbands have left them. In my national public role as the national spokesperson, women have come up to me and shared stories where the husband said, I'm sorry, I didn't sign up for this, and have left them. The husbands were the ones with the jobs with health insurance. So now the woman is gone, no health insurance. She loses her house, she loses her cars. So I was blessed to be in a situation where I wasn't counting on that. I was the one with the insurance. I didn't have that, but people, they don't think about how cancer, outside of affecting the body, what it does to all the intimate relationships you have with your coworkers, with your spouse, with your partner, with your children. It impacts everything. And that impact does not go away simply because people say, you're a survivor. Doesn't go away. You deal with it every day. You just don't let it bring you down.
You've spoken about family, about support, the loss of a community, clearly. What does one need? What do you need in your case? And I'm sure you'll be speaking for a lot of people, because sometimes we see someone's going through a lot, but we're not sure how to help, what to say, how to ask if they're okay, because clearly they're not okay.
Correct.
And we're not sure if not asking is the way to go, or should I ask?
Right.
It's such a sensitive time and space for everyone.
Yes.
How does the community approach a person that's going through cancer? What does the person need?
Yeah, that is such a good question. At the time I was diagnosed, my mom was in the end stages of her life. Actually, the day that I found the mass, I was waiting for a call from inpatient hospice. She would go into inpatient hospice for the last time to make adjustments in her medications. And so throughout my course of treatment, I had received 3 treatments of chemo, and then I was diagnosed with a congenital heart defect that is potentially life-threatening. And then I get discharged from that, and my mom dies. So there was a lot going on. And there were many people who would not ask about my mom after the homegoing, because they felt like, well, if I bring her up, like, how are you doing, then it's going to make her hurt her again, or take her back into depression, or make her think about her mom. Others would not ask me how treatment was going, because it was, I'm going to work, so we're just doing it, so Sheri doesn't want to talk about it. Or they'll say, give me a call, let me know if you need anything. And so now that puts it on the patient. Now I have to call you. Now there's something else I have to do. I already have to go through treatment. I already have to go on trying to continue my life as usual. And now I have to call you to ask for help. And it's such a good question. And it burdened me so much that when I came through this journey, I actually wrote a book. It's called When Everything Changed, My Journey from Physician to Patient. And it is more than just a book explaining my journey. There are others that have written about their journey. But in that book, I talk about what co-survivors and caregivers and co-workers did to me, that I experienced, how it made me feel. I interviewed some other cancer patients, and then I offer some helpful advice on what to do. And one thing I can definitely tell you to do, continue to ask that individual, how is treatment going? How are you doing? All right, you doing good? All right. And if they say, well, it's kind of painful, well, what kind of pain you're experiencing? Because that lets the person know, I care, I do want to know. I'm not trying to get information for information's sake, because I want to know how you are doing. If a person has a death during that process, ask about that person, because it keeps that person alive for them. Just because you don't talk about it doesn't mean I don't miss my mom. Matter of fact, it makes me think that you've not pushed her out of your mind and make me think that I should push her out of mine. I'm sorry, I think about my mom every day, and it has now been 15 years. I'll never leave that. So ask, and then please don't say to a person, call me and let me know if you need anything. Just take a moment, just take a step back and say, if I was going to chemotherapy and I see this person losing all this weight, their color change, I was pale as a sheet, but my nails and fingernails were black and dark. I'm thin because I can't eat. Everything tastes like rusty nails. Main thing I could eat, I could drink milk and eat any form of potato. But other than that, don't put a lot of garlic. And I love garlic. I love seasoned food. But I couldn't while I was going through chemo. So how could I cook for my children? I can't take the smell. So stop and think. If a person has children, hey, sweetheart, what do your children like to eat? I'm going to bring some food by. I had a good friend who once a month, and she was pregnant. She's also a physician. She was pregnant with children of her own, would come by and bring me food, cook food every month, and bring me groceries. I never had to ask her. There was a running list of groceries, and if there's something special I wanted, I simply texted her. So she did what she needed to do. Those are the things that a person going through a cancer diagnosis and treatment need. They need to know that you care about them and you want to help. So don't say, call me if you need me. Say, what can I do for you right now? And if they say nothing, well, what do you need next week? You have an appointment? You want me to take you to chemo? Girl, I got you. Don't worry about it. I'll drive you to chemo. I'll drive you to radiation. I'll take the kids this weekend so you can have a weekend to yourself. I'll get your groceries. Give me that list. The things that you do every day, if you're a woman who may be married or may be single and raising children, think of the things that you do. I still need to do them, but I can't. Or if I do, it's very difficult for me. So just assume one of those responsibilities.
Wow.
Yeah.
So good. Yeah. No, that's so good. And it's good to hear from you, because you've been in that place. And I think it's also kind of just given others permission to say, you know what, we can fully be there for each other. Because sometimes you're not sure if that's the right thing to do or not.
Yes. Be there. Be present.
Yeah.
Be present. And through the course of me living through the ups and downs of, people in church wondering where my faith was, because I'm getting all of this treatment, through co-workers seeing me work but feel like, okay, well, Sheri's good, so we won't ask about the treatment because that may, make her feel depressed or something. Going through all of that and pulling all those things together for the book, I had gotten to a place when I came out of learning about my congenital heart disease, and when the cardiologist told me what it was, I remember reading about it like in the textbook, like a sentence, because it's like so rare, and it's less than 0.25% of the entire population has this condition. And as a result, there are 3 things that can happen. You can live with it and never know about it and die of something else. Or you can have a massive heart attack, which is what I had, and that's how they discovered it, and live. Or you can have a massive heart attack and just die, all without warning. My chest pain came on very, very quickly. And so as a result of that, knowing that I'm sitting here now in this interview, and I could drop at any time. But the beautiful thing now is, if I drop now, I'm doing exactly what I've always wanted to do. And when I came through all of that, I heard the voice of the Lord one day say, live. And in my mind, I'm thinking, well, I did that, and it's been a hard way going, Lord, getting through all the treatment, and then this heart disease, and then my mom dying, and it was just a lot. And I'm like, live? What more can I do? And then after 2 weeks, the Lord revealed to me, live means to love yourself and others, inspire those around you, voice your dreams and ambitions, and enjoy life. Live today and every day. And over the course of developing lymphedema and realizing that there's no resources for cancer patients about lymphedema, they don't even talk about it, I started my own nonprofit. And what did I name it? Live Today. Yes.
Live today and every day. Your story is such a full story, and there's so much that we could get into. I'm so happy that I think now people have gotten into the mind of a survivor and someone that's actually lived through the process. Yes. That's life-threatening at the end of it. That is truly walking through the valley of the shadow
of death. Yes.
That's what it is.
Yes.
And you made it on the other side, and now here we are. Thank you so much for sharing your story, and thank you for saying yes. And of course, to everybody at home, please be sure to follow her Facebook page. I'm sure you'll be able to get even more information. I'm sure she'll be able to, hopefully, if she has time, reach out to you as well if you end up writing her. But on that note, thank you for joining us. We'll be back next week. My name is Ruth Lacey.